Millions of people are returning home tonight after another busy holiday travel weekend riddled with flight cancellations and delays amid the pandemic. It comes as the state sees its highest COVID count on record. A number of health officials worry will likely rise in the coming days.
This is no time to mince words. This is flat out alarming for our state.
Strong words from state health leaders as cases reach new highs in the Palmetto State.
We recognize at this point that people are numb to the data, but these stats aren't simply numbers. They represent people. They represent people who are our family members, our friends, and our loved ones who are sick, who are hospitalized, and unfortunately some of whom are dying from this disease.
On Sunday, the line for COVID testing circled the parking lot and stretched down the road at DHEC's Bull Street site. This comes after the agency reported over 8,800 new cases across our state on Friday, the most seen since the pandemic began. Hospitalizations are also on the rise, including people on ventilators and in the ICU. Doctors urging those with mild symptoms to stay home.
Aren't having any difficulty breathing or catching your breath, I recommend trying an over-the-counter antihistamine or some Mucinex, and usually symptoms resolve in a couple of days.
The rise in cases comes as schools prepare to return from winter break, with the State Department of Education urging families to consider DHEC guidance to stay safe. Meanwhile, the impact from holiday travel is still unknown.
Get yourself tested if you have any reason to think you might have been exposed or have symptoms, and definitely get the vaccine and your booster as soon as you're eligible.
While state health leaders work to add more testing sites, the concern, cases will get worse before they get better. The surge in new cases has been fueled by the new Omicron variant, but health officials say it appears to be less severe than previous strains. So what should parents know about the virus when returning to school, for some as early as tomorrow? Following the CDC, DHEC has made some changes to its guidance for schools. The health agency says in order for students and staff in isolation to return to class, you should wait at least 5 days after showing symptoms and 24 hours since your last fever without medication. Your symptoms must be significantly improving, and you'll need to keep your mask on for the first 5 days when coming back to class. If you're exposed to someone with COVID, you can stop your quarantine after day 5 if you test negative with no symptoms. You'll need to take the test no sooner than day 4, and a mask needs to be worn through day 10 of quarantine.